Hey everyone, it's Dr. Andrea with Restoration Chiropractic in Calabasas. Just popping on to talk a little bit about pregnancy. I've got quite a few pregnant women in the practice right now, and a very common complaint of pregnant women is sciatica. So sciatica is basically a sharp shooting pain that starts in the low back and then goes down the leg. So it can go down maybe just into the butt, or it can go down into the thigh, like the back of the thigh. In really severe cases, it can go all the way down to the calf or the toe or the ankle. I should say the ankle or the toe, since the ankle's first. But it's no fun, especially when you're pregnant. It's very common in the second and third trimesters, and there are a couple of different reasons why you might have sciatica. So let's talk a little bit about those. The first reason you might have sciatica is as your belly grows, as the baby gets bigger, your center of gravity gets pushed forward, and then what happens is all of the stabilizing muscles of the hips have to compensate, and there is one muscle called the piriformis. It's a super big, thick muscle. It basically runs from the center of your butt out to your thigh, your leg, the outer part of your leg, and that muscle can either get tight or it can get loose. I know that sounds a little weird that it could do both, but it depends on basically what's going on in terms of the pelvis. So if that muscle gets tight, sometimes the sciatic nerve actually runs right through it and it can compress the nerve. Sometimes the sciatic nerve runs underneath it and it can put pressure on the nerve that way. So like think of it being pushed down. And so what will happen is then it will cause that nerve pain to shoot down your leg. So piriformis, which is that big muscle, basically piriformis syndrome is one of the reasons for sciatica. Another reason for sciatica could be coming out of the low back. Basically, one or more of the vertebrae of the low back may be rotated just a little bit. The sciatic nerve exits the low back at 3 separate levels, L3, L4, L5. There are 5 lumbar vertebrae in the back, and so any one of those rotated out could cause some interference or some pressure on that nerve, and then cause that nerve to be irritated and send pain messages down your leg. And then the third reason, and this is the most severe of them all, is you could have some sort of a disc herniation where the little gel cushion in between the bones actually dries out, and so the inside gel nucleus basically pokes out where it shouldn't, and it puts pressure on the nerve. That is not nearly as common. The absolute most common reason that women get sciatica in pregnancy is that piriformis syndrome. So basically just pelvic imbalances of the hips cause that muscle to either get too tight or too loose, and it then puts pressure on the nerve, and so you have pain shooting down your butt and into your leg. Super easy to fix too. That last trimester, if you're not under regular chiropractic care, I really do suggest looking at adding that back in, because keeping your hips and your low back aligned can really make you so much more comfortable in that last trimester of pregnancy. A lot of women who come into me for sciatica do continue with care throughout the rest of their pregnancy, just because they feel so much better doing it. I mean, it's pretty hard to get comfortable no matter what in the third trimester, especially the last few weeks, but chiropractic care can help. So my office is in Calabasas. If you have any questions, feel free to call me, 818-661-6369. If you found value in this video, please hit share and send it off to your friends. If you know anyone who's dealing with sciatica in pregnancy, please tag them. And it's Dr. Andrea with Restoration Chiropractic. I will talk to you soon. Thanks. Bye.